It's easy to look around and notice everything wrong in your city. In this podcast by Every Neighborhood Partnership, join Grace and Andrew as they invite friends, activists, pastors, leaders, and city workers to discover what's good in the neighborhood. Join us for insightful conversations that will encourage you to see your city and its people in a new way.
Welcome to What's Good in the Neighborhood. On this week's episode, we talked to Nolen Burchett of Touchstone Recovery and Ahmad Bahrami of Fresno County Behavioral Health. And this conversation really is spanning both substance abuse and mental health issues. And we get into like their personal experience as what are folks encountering those issues dealing with. But both of them have really interesting perspective. One from a more county-wide lens, and then Nolen from like actually running recovery centers. And so this conversation really talks about what are stigmas that we have in our community around mental health, around addiction issues. What are also some of the barriers that are keeping people from being healthy and whole? So really fascinating conversation that gives us insight to what is going on, how these issues also relate to homelessness and other issues in our community. So really fascinating. I'm glad to have their perspective, and I know you're going to learn a lot. So stay with us.
Well, welcome back to What is Good in the Neighborhood. Andrew, how are you doing?
I am doing fantastic. It is the fall. All my kids are in school, so that's great for them, great for us. And how about you?
Yes, same. I'm probably more emotional than you because I have a kindergartner and a TKer, and it's, every day is sad.
And your daughter and my son are hanging out.
Yes,
which is fun. So
they're buddies.
Cool. Yeah.
So good. Well, today we are still in our series called For the Long Run. We're talking about systemic issues that are not going to get fixed overnight. They're long-term issues that also need long-term solutions. And so we thought that it would be really important to bring in experts in those fields.
And we are getting really good feedback. I keep in random conversations, people are just like, man, I'm learning so much. Like these are not issues. I hear them talked about publicly, but I don't know people that are close to the solution. Mm-hmm. So I'm just really glad we did choose to do this and then bringing on experts because we are not, but also realizing these are really complex issues that take a myriad of solutions. So I think we're just like tapping into something that is really helpful.
Yeah. And like in a voting season too, when these issues are getting thrown around as like a voter issue, but you don't actually ever hear from the people that are involved in that. It's really important. And it's been really great feedback as well. Today in studio, we have Ahmad Bahrami, who is the division manager over at the Department of Behavioral Health here in Fresno County, as well as Nolen Burchett. He's the executive director at Touchstone Recovery Center and also owns and operates 7 sober livings here locally. So you guys, welcome. Thank you so much for being here today.
Thanks for having us.
Well, awesome. We are going to jump right in. Let's start with Ahmad. Ahmad, tell us, how did you get into the work that you're doing today and what keeps you in it for the long run?
Yeah, good question. I don't know if it was a clear path. I think it was just wanting to do something in terms of serving the community, serving people around. It eventually got me here. Out of high school, going to college, I studied criminology, but was not necessarily focused on law enforcement side, but was more of the rehabilitation, the counseling, the correction side of it. My first internship and job out of that was working in inpatient substance use, working with ex-offenders. That kind of evolved over the years. Wanted to kind of put my ideas to test, and I knew to do that, you would either have to stay in an organization a very long time, you get seniority, or you would need some additional education. And so I went back and furthered my education, which led me into administrative roles. But I've been in the broader, I would say, for lack of a better term, like social services, human services field, doing whether it's been justice or mental health. And I've been now in the mental health field or working county mental health for almost 16 years.
Wow.
But I think it just goes back to kind of I feel my calling was always like public service. So that's kind of what I think maybe gravitate to those, and maybe what continues to keep me in there is like public service. And it's like the work's not done. There's a lot of stuff we still need to get done. And so I don't know if it'll get done by the time it's ready for me to retire, but I think having that calling just kind of makes it like there's work to be done. We just got to keep working on it.
That's great. Thank you for sharing. What about you, Nolen?
So I struggled with drug and alcohol abuse for a long time. Went to college and was a business major and I was a produce exporter for a long time and got myself into a lot of trouble due to my drug and alcohol use. So I worked with people like Ahmad when I got incarcerated and went back to college and got into this field because I felt like in my previous life in sales, I just wasn't fulfilled. I didn't feel like I was doing anything that I was proud of. I wanted to work in a field where I had like a personal relationship or a personal experience with the people that I'm working with. And I know a lot about addiction through my own personal experience and now through education as well. So I got into the substance use field while I was still incarcerated, took classes to become a substance abuse counselor. After I got out, I continued going to college and then got into this field about 6 years ago. And I fell in love with it. So usually like the sober living part of what I do, I noticed a need. There's not stable sober living environments or at least there wasn't in Fresno a few years ago. And so a friend of mine and I decided to open a couple, and it started with one and now we're up to 7. So we have.
They were there, like other options existed. They just were creating chaos or like, what did you see? What gap did you see?
So there wasn't a lot of accountability. They weren't drug testing on site. They didn't have structured rules. And, most of them, at least the ones that I was familiar with at that time, weren't connected with a treatment facility. So at our sober livings, almost 90% of the men and women that live there are currently in outpatient treatment. So they have a structure. They have a time that they need to be a group every day. They have a curfew at night. They're getting drug tested multiple times a week. It's a structured environment that gives someone stability and prepares them for the next step, for like independence and moving on.
Yeah. Versus just like a hostel,
just
or
like
something,
like a halfway house or something, which, I'm familiar with those too. And they do have their advantages. I think when you're struggling with opiate addiction or alcoholism, the accountability part was really big for me in my recovery. So we decided to implement that as well as some other things.
Yeah. And just to make it personal too, 2 years ago, my brother was an addict and needing help. And he was in an inpatient facility and his insurance ran out. And I lived here in Fresno and he lived down south. And he called me and he's like, I want to continue to get sober. And so I was like, well, I know nothing, like literally nothing about this world or even addiction. I knew that my family felt the effects of it, but I didn't know what to do next. And so I literally just started Googling and found Touchstone. And I was like, I'm sure you guys talk to people like this all the time that are just like fight or flight. Like I went full into fight mode. And Nolen answered the phone and he was so kind and was just like, bring him here. Like, I want to see him tomorrow. And I was like, okay. And I think he got up to Fresno from down south and we walked into Nolen's office the next day and it was like, we're doing this right now. Like he needs to come right now. And so that's what connected Nolen and I. And that was 2 years ago. My brother's been sober since. And so, so I have experienced everything that you just described personally. So it's really great to have you here today and to like have this conversation and also have the knowledge of like you're doing what you say you're doing, because Jonathan's now managing one of those sober living houses, which is great.
Yeah, he's a success story for sure.
Yeah, he is.
Give us like, for some folks, like it's kind of just whatever you see in the news. So if from your different vantage points, right? What do you see as like the current state of, mental health issues in our valley or addiction kind of issues in our valley? Like what are we dealing with? What is going on in our community?
Good question. There's a lot happening. I think it's you've got to get down to like the actual facts of it. We've had mental health and substance use issues long ago, and unfortunately, I don't see them going away soon. But we can continue to work towards that goal of eliminating it. I think there's a couple of things that really are challenging. Is that different things come up, and that's kind of where people's attention goes to. So, as devastating of, for example, impact fentanyl has been having, for example, on our valley and people here, we've not gotten rid of, for example, the methamphetamine problem that we've had in the valley. Like it's still there.
Yeah.
We and maybe like a dark humor kind of go like meth is king still. But when you look at statistics in terms of overdoses and things like that, like fentanyl's getting up there. So it's not that it's not an issue. I think we tend to think of things in like one or the other versus like, no, there's a lot of issues and a lot of them are interconnected. And to address one, you kind of have to address a lot of other issues. I think for mental health,
is like the Fresno County Valley, when you look at our statistics, like are we similar to other California cities or valley or counties, or is it like just some perspective, right?
Yeah, if you, I think we still have, as far as reported high, drug use, we have still, I think, people reporting, for example, methamphetamine use. Self-report is one of the ways you get it when they're doing like an intake. Some of it is what people are tested for, admitted to if they're arrested and in charge. Some of it is what hospitals see, and some of it is with the coroner and autopsy. But we've had those challenges and issues for a long time. So it's kind of, again, I think they're intertwined with a lot of other things that you have. Mental health has been an issue. I think we've seen an increase of it, and that could be a lot of factors. I know there's a interesting book, I'm not trying to remember the title of it, but it really just talks about access to smartphones and social media, and the impact it's had on for children especially.
Oh, the new Jonathan Haidt book.
Yes. Thank you, Andrew.
Yeah.
Yes, I'm like halfway through.
It's on my Amazon list.
Yeah, so I have it. I'm halfway through it, and I'm like, as I'm hearing it, reading it, and I'm driving, I'm like, I need a hard copy of this because I got to highlight all these things. So you have those things. You had the pandemic and the impact. And if I was to say like the pandemic had a silver lining, well, it created a lot of anxiety, disruption, stuff like that. I think it normalized and it really highlighted the need for mental health, and more people are not talking about it. More people are interested in it, seeking it. The challenge we have is in the Central Valley and in the region, we've been a mental health shortage area long before the pandemic.
Like we don't have staffing, is that what you're saying?
We don't have psychiatrists, psychologists, therapists, substance abuse counselors to meet the demand. We haven't for 20 years. So when people go like, oh, the pandemic, I'm like, that might have impacted your region. Same thing when you look at for like nurses, things like that. We've been a shortage area in the Central Valley for a very long time. And so that has an impact as the demand increases. The demand could increase for a couple of reasons. Demand could increase, just your population grows, more people statistically. The demand could increase as you get certain kind of ebbs and flows where substance use and alcohol use goes up and down, but meeting those demands. And then as people become more aware, and I think we've really done a good job in California for the past 20 years, really talking about like stigma and trying to get over that stigma. So it makes it okay for people to go get help. It makes it okay for people to talk about it. It makes it okay for you to share that you have a family member that struggled. Because before that, it'd be like, I'm not going to hide it. I'm not going to talk about it. Well, who's going to learn and get help? So I think we've done a really good job in that area. But I mean, there's a lot of things, but I think the workforce shortage of it, and it's not that we don't have people in those trained to do that work, that have the competencies to do that work. And it's a broader range from, like I said, from like the psychiatrist to peer support. I mean, those I think is a challenge because the demand's going up and it's like, are we able to keep up with it? But I'm going to let Nolen.
No, I think you hit it on the head. Is the stigma is alive and well in our county. I deal with it especially with the sober living environments. We want to create and provide a stable environment in a nice neighborhood that's not next to 40 liquor stores for these young men and women and older men and women to engage in their recovery, go to treatment, but nobody wants them in their neighborhood. And every time we open one, it's an issue every time. And Yeah,
do you have to like, this is nitty gritty nerdy question? Do you have to disclose that? What's like
No.
You don't, just
but-
people see
you're under
or
a
notice
certain
or
number of
Exactly.
yeah.
As long as you're, within the law,
Yeah.
and you don't have 15 people in a house
Yeah.
or something,
Yeah, yeah,
but
yeah.
there's, neighborhoods just, they want to help solve the problem, but not in my neighborhood.
Yes. Yeah.
It's a tough issue to get over. So we deal with that on a daily basis, and it makes sense. I live in a neighborhood myself, and I could imagine how I would feel if a sober living opened next to me. But I mean, I know that those people need help, and I mean, having a sober living in your neighborhood, the houses are really nice. They have chores every day to do. They're drug tested. They have curfews. It's like the dream neighbor. There's no parties going on.
It's almost
there's literally no parties.
if you really think about it, though, in this context, Nolen, like that sober living, a structure one like what you're talking about, operating things like that, potentially because you're drug testing people, you're tracking people's things like that. It may be the spot in your neighborhood that has the least amount of drugs.
Yep.
Because there may be houses on your block
Yeah.
where teenagers are holding on to more drugs. There may be in certain houses in your community, and I'm not saying this in any kind of a judgmental way, but there may be houses on your street where their medicine cabinet contains more dangerous, drugs. A lot of times just inadvertently, I had this from the surgery, I have ones left over, and I just leave it in there. Well, anyone can get their hands on it, right? One of your kids' friends, stuff like that. So sometimes I think the argument is just like, there's less drug use in this place than there's probably the rest of the block if you really think about it in that. But it's that stigma, like, well, you're different. You've done this, So I think we've still got to, as Nolen said, continue to work on the stigma part of education.
Yeah. Sure. Talk to us about, I've heard this a few times in conversations, and also when we chatted on our homelessness episode, but that drugs are different now. Or they used to be this way, but with time and technology and the trafficking of drugs, it is a different type of drug that you take. What is that? And how has that evolved over the last 50 years with substance abuse?
Immediately what comes to mind is the marijuana potencies. We see people they're in psychosis from marijuana, which, I don't remember that being a thing 10 years ago, 15 years ago. But the wax and the stuff that they have access to now is the potency is so high that, especially in the younger populations, they'll show up to treatment and they're in psychosis from marijuana. Another thing that comes to mind is fentanyl. Like it's not like when I was in high school where, I'd go and party one weekend and I didn't have to worry about overdosing. Now it's, you never know what you're going to get. You might be at a party and think you're doing some cocaine and you overdose on fentanyl. And it happens all the time. So that's the biggest difference in my mind.
Yeah, I think maybe like the difference too is our approach needs to be a little different. So back in the day, I don't know. I was born in the 70s, so I don't have much recollection of that. But I'm saying, like, in general, like when I was a kid, like if you wanted info, you had to go and grab an encyclopedia off a shelf.
Took some work.
Like that, and whatever info, whatever year that was, this could be 1981, and encyclopedias from like 1971. It's info that's 10 years old. I think nowadays, kids and people in general can get so much information. And so it's us providing credible and useful information. So I think, before, and when I'm saying old school, like, you see the clips of Reefer Madness, right? Yeah. Which, at that point back then, you're like, I don't know if it's going to really do that nowadays. I mean, I don't know the potency, but when you see that and people can go, I can look it up and find out the info, it kind of discredits us so people can disengage. And I think us trying to use fear as a behavior change tool is not effective, right? I always use this example of if your kid runs out into the street and they almost get hit, you can spank them. And so you're hoping the fear of them getting a spanking is going to stop them from running into the street. They still didn't understand why they got the spank or why they didn't want to run into the street. If you can explain and demonstrate and help them know, like, look, this car is a lot stronger than you. If you run out, car doesn't see you, can get hurt and hit. Now they have information to go like, oh, that's why I shouldn't run out into the street and I should pay attention. Look, more likely that they're not going to do that versus you're hoping the fear to. So I think part of it is like there's way more access to information now. And so us trying to use maybe strategies before, like we're going to use a little bit of fear is not as effective. We have to have more candid conversations. Yes, this, and this is correct. It also has these side effects. Oh, you saw that? Oh, so, okay, so you also know that fentanyl can also not, well, I don't do fentanyl. Yes, correct. And here I can show you all the news stories and stuff that's factual stuff where it's been found in other things. It's been found in counterfeit pills and things like that. Why risk it? Yes. Having more conversations where people can be informed and so they can make an educated decision, I think is going to be one of the things that can curtail that, because before we would be like, marijuana's bad. Okay. And I'm just using that because you brought that up.
Sure.
But then kids will go up and now they can get on their phone and be like, I found 10 studies that say it can do A, B, and C.
It helps with anxiety.
Yeah. And I'm like, okay, but if you see on this one, you didn't read the fine print that is talking about like for someone 30, not for someone who's 18, whose brain is still
developmentally.
Growing. And so we got to have those, instead of like, no, you're wrong, say like, okay, I hear you for the anxiety, but let's look at that study. What did this mean? What was the samples? Oh, it's people this age. Here's the study that says if you're in this brain development period, it actually is going to have a negative effect. Now with that info, maybe you can make a better choice versus kids are going to do stuff just opposite of what we tell them as adults, right? Don't do this, I'm going to do it. So I think having more candid conversations with, because they have access to information, steer them to the right information. You're right. And yeah, some studies say for anxiety. Let me show you the full study that also says, but you have to dose it. You can't be all day. It's not going to help you with anxiety. Or there's a side effect. Yes, it helps with the anxiety, but if you're doing it to this point, now you're having this side effect where now you're not working or you're experiencing something. So because with medication, they tell you, take this. This is the doses. This is what you do. These are the side effects. When you're doing it yourself, self-medicating, how are you managing that? So I think we got to have like just more, the stigma reduction, but like educational discussions so that people have the info and they can make the decision. Because if not, they're just going to get on their phone and pick and choose the.
Nolen, as you do the work that you do, what do you see as the connection? But folks are entering with typically a substance abuse issue, and but what is the connection, and how do you all work on folks' mental health? Like, what connection do you see there? How are those intertwined? How do you link that?
I mean, almost every client that we admit at Touchstone has a co-occurring mental health issue. Sometimes that's it's like the chicken and the egg argument. We don't know which came first. Usually people are self-medicating because of those pre-existing issues. So, I mean, like I said, we see it almost every single client where it's typically going to be anxiety, depression. A lot of times it's trauma related. And that's what leads people to, in some cases, leads people to their alcohol abuse or leads people to self-medicate, is they're trying to not feel that. So the way that we address that is obviously we address the mental health issues while they're in treatment. First, stabilize the substance use and get people a solid foundation, have them start working with a therapist. They see our psychiatrist once a week. And, we try not to diagnose too quickly, because when a person comes in and they've been using meth for 4 months straight every day, just give them some time to stabilize before we throw a bunch of medications at them. So, but yeah, it's definitely a team effort from our mental health professionals and also our substance use counselors. And
as you were saying there, you look at a lot of those issues as having been issues they've been holding on to for years, and I know there's been a growing body, and your department's done a lot of work on some of that, like trauma-informed ACEs. Like, is that kind of like, what are those inciting incidents in these now adults? How did this trace back in their childhood or?
Well, usually it's, addiction runs in the person's family.
Okay.
A lot of the trauma is when they're in childhood, but it's all stories are unique, but they're also very similar in a lot of ways. So in most cases, I would say that the mental health conditions are exacerbated by the substance use. So a person comes in and they're diagnosed with opioid use disorder and generalized anxiety disorder. We don't know which one came first. We know that we need to get them off the opiates first, and then we'll start working on that generalized anxiety.
Yeah. I think also I've seen is like you've given them other opportunities, other ways to medicate in a different way,
Yeah.
right? Or like healthier options to deal with their anxiety or their depression.
No, yeah, I agree. I think at least at Touchstone and most of the treatment centers that we work with closely, it's all hands on deck. So we have a health coach that works with them and tries to get them back, feeling good naturally. So, physical fitness, a good diet, all these, family time. So we have a family therapist that works with people and their loved ones. It's not just, stop using drugs and everything's going to be fine. We have to replace those behaviors. We spend a lot of time and effort getting high and staying high, right? I know I did. So all that time needs to be replaced with something productive, and also we want to feel good.
Yeah.
So I know when I get up in the morning and I go on a run, it starts my day off right. I'm going to keep doing that because I surely was using and drinking every day, so I need to take proactive action to make sure I don't continue every day. And we encourage that in all of our clients.
Well, I love even kind of what I've heard even from Grace's story and even what you just mentioned too, is like that person has to also repair relationships around them. Like there has to be reintegrated into a healthy family system.
Sure.
Or find a family system that they can feel like they belong and is safe. And those dynamics typically with addiction have been playing out for years in that family. So they all have to be part of that process too.
And unfortunately, in the private sector, so we take private insurance at Touchstone, we don't get long treatment stays. We're able to keep people in inpatient treatment for a month if we're lucky, and then they're in outpatient. So they're reintroduced to all those triggers. They're driving by liquor stores every day. They run into the guy that they used to pal around with that used with them. So it's 1 month later, they're back into the real world. So that's why we encourage people to go to sober living while they're in outpatient. And then the outpatient stay can be 3-4 months if you're lucky. So that means years of drug abuse and addiction gets treated with maybe, if you're lucky, 4 to 5 months, of basically learning how to relive your life in a healthy way. So in my opinion, that's not enough, but it's what we have to deal with.
Yeah. Ahmad, talk to us a little bit about what you see in the county as far as the connection between homelessness and mental health. When we chatted with Zach from Poverello House, he was saying they hold hands. What do you see from your perspective at the department?
So I think with that particular topic, and then looking at studies and things like that, I think there's three things. There's people who have mental health and substance use. There are people who are unhoused or homeless but unhoused. And then there's people who are unhoused and also have a mental health and substance use. I think there's been a lot of it and depending on what you do, if you do primarily outreach, every day with individuals that have substance use and are unhoused, you kind of see that. It's like when all you got is a hammer, everything starts to kind of look like a nail. But I think it's broader than that, because when you look at, for example, so I think that the issue with if you're unhoused and you have a mental health or substance use, that's going to exacerbate your situation. It's going to be harder to get into it. Yeah, it's going to get into it. If you have an untreated mental health or substance use, it's going to put you at greater risk for being unhoused. And at the same time, you have to look at just like the cost of housing, not nationally, just look in Fresno, how much has gone up in the past 5-6 years. If an individual is coming out of treatment, unemployed, things like that, how are they going to afford housing? How are they going to get into housing? If someone is on a fixed income because of their disability, because of their mental health, how do you maintain? Those checks don't adjust with the rent. They don't adjust with gas prices. They don't adjust with food. So I think we have to understand that housing has an impact on individuals with mental health and substance use, and individuals with mental health and substance use are going to experience maybe housing insecurity at a higher rate or warmer situations, but I don't think they're one and the same. Because if you look at, I think it was UCSF that did the statewide study on homelessness about a year ago. And the state used kind of lifted parts of that, but they talked about the number of people that had mental health, substance. The one that they seemed to just not really highlight on was that the common factor for all the people was the cost of housing. So a lot of people that were unhoused, the bottom line is like they could not afford, housing. And so I think we've got a affordable housing crisis. I think we have a housing inventory issue of like there's just not enough places to house people. I think we've got a poverty issue, which is more complicated to address. And then you have mental health, substance use, all those things. So I think it's a culmination, and I don't know. If you look at some of the numbers and the point in time count and stuff like that, and you apply that number liberally. So you say, like, we're not even going to go with 35. We'll say half, 50% of the people that are unhoused have mental health and substance use. Okay. And Nolen and I get them all into treatment, into sober living tomorrow. You still would have 50% of the population that's out there. You still would have, and I think it's the point in time count was close to like 2,000. So you still have, and the ones that are not in that number are families, are children. So why are they unhoused if it's just that? So I think it's all. It's not a either or. I think it's all. It's a poverty issue. It's a lack of affordable housing issue. It's a housing inventory issue. It is a substance issue. It is a mental health issue. It's all of these things and all. And I think at times we risk not having the most effective solution if we're kind of looking at it just from like a singular. It might be easier to tackle. Maybe like, okay, how do I handle this? So Nolen and I are going to start working on the substance. That might be a way where we start. But I think if we're trying to really look at addressing and supporting, it's got to be a broader. We got to understand all those things. It's not just substance use, because a lot of times it's co-occurring, and it's kind of the chicken or egg point that Nolen made. It made me think about. You have that a lot of times with housing. Now, I think substance use is underreported when you do the point in times. And I think with people that are unhoused, I think the number is higher. But I think the question that we should really be asking is like, how many people developed a mental health or substance use challenge as a result of being unhoused? And I think in that UCSF study, it wasn't half, but it was a nice chunk of people that developed it. So I'm like, let's say you had everything, and now because of either your mental health or substance use, you are destitute on the street with nothing to go, and you've been trying to put it up, you've been trying to find jobs, your situation gets more and more difficult, challenging. You're like, I can't even go looking for a job now. I haven't had it. At what point does a person kind of go like, I give up. Just give me a bottle.
Well, I was just
not saying it's okay,
I was just gonna say, in my own my own personal experience, like insurance was the barrier. So when you're talking about like the underlying issue, I 100% agree. It feels almost like it's almost like an iceberg issue, 100%. Right? So it's like when we talk, people have the will to get better. They don't want to be unhoused. We are human beings. We have dignity. We want the good things for ourselves, but there's barriers to entry. So when you're talking about housing, when you're talking about jobs, when you're talking about insurance, it's like there are things that are fighting up against people's stories too.
Yeah, and one of the things that Nolen pointed out, you talked about, which I think can be frustrating, I think, for us just as residents, in the community, is there's parity laws on the books when it comes to health access, which means you're supposed to be treating physical health the same way you're treating mental health and substance use.
That's not actually reflected.
I don't know. That always happens. And that's where we sometimes hear people saying, like, for certain services, it's better if they're not insured, because then through the public system, for example, through a Medi-Cal, they can get a longer treatment. They can get certain. I'm a parent and I've worked for the county. I got good insurance. Oh my goodness, that thing is hard to try to navigate. Calling the number in the back, trying to figure out, do I need to now imagine you don't know what to navigate, how to navigate all those things. So I say that as a person who has private insurance. So I'm not knocking private insurance, but I think our parity laws can still evolve to where we achieve eventually true parity. Say, like, whether you have diabetes or an addiction, they should be treated the same. If you can get a prescription and a doctor and stuff like that, then you should be able to get a counselor, therapist, whatever, easily access. I will put a caveat. So I want to make sure I'm not blaming. I don't want my insurance getting canceled. If they do, I'll be like, no, I can show you the podcast. This is no, but they're also in the same predicament of the shortage area as well, mental health shortage. So it's just like the insurance, like, I'll pay for it, but there's not a therapist that has an appointment open for 2 months. We'll pay for your medication, but you can't get in to see a psychiatrist for however long.
Right. It's like a snake eating its own tail in a lot of ways.
So you and and I don't know if you'll get to it later, but in California, I don't think we've put enough emphasis on the role of substance abuse professionals. So if you look at, and I don't know for insurance, Nolen, but like in the public sector, the reimbursement rates are really low. So for the work that they're doing and the specialty and the expertise they bring, it's really low to where someone's looking at like, I got to go to school, get an AA. I have to do 100 hours. I have to get certified to provide the service. And because it pays so low, whoever the employers can only pay you so much, right? They can only, because based on what they can try to, I think it was in San Diego that they were saying that people are like, I can go work at Panda Express and get benefits and the same as I would this job, and I don't have to get
as a substance abuse counselor.
And this was in San Diego. It's a lot more expensive.
Have you experienced that, Nolen?
Sure. Well, I mean, recently we had to raise our, like, what we hire people at. The amount used to be under $20 an hour, not for a certified substance use counselor, but that's gone up significantly over the last couple of years. And yeah, I mean, of course, I feel that our substance abuse counselors are underpaid. I mean, I kind of take pride that at Touchstone we pay them better than anyone else I know in the Valley. Mm-hmm. It's still not enough.
Yeah. What on your end, and what I hear you mentioning, Ahmad, is there's like a stigma or systemic changes. Would you have any? If you are like magic wand, I'm gonna change this stigma about addiction or this systemic issue I keep running up against. Would there be something there?
Sure. Yeah. So, my admissions team, which I did admissions for a while, I love that part of it because that's when people call and they want help for their loved one, they want help for their family member, they want help for themselves in the best case scenario. But when they call, they're just desperate and they need help. And like my admissions team, we take pride in like finding them the resources that they need right then, whether it's us or not, which in most cases, it's not us, so.
Well, to stop you for a minute, you helped me through the inpatient insurance. So you said, call this person. So you probably don't remember.
Not that part.
Yeah.
I remember talking to you.
Yeah, but we talked for like 3 days. So it wasn't even about Touchstone. It wasn't like, all right, let's get him here at first. It was like, well, okay, call this person, do this. And then I think later on.
Systems navigator.
Yes,
you got to be a systems navigator.
Yes, you fully help me navigate.
It's complex. Like, I mean, like calling the number on the back of your car. It's not fun.
That doesn't solve the problem.
So, we have some inside information. So we're going to, give people the tips they need to get their loved one help. But yeah, the bottleneck that I see is, over half of the calls we take are people with Medi-Cal. So we give them a list of resources. The one service that I see a shortage on is a detox facility for people with Medi-Cal. Right now in Fresno County, we have CAP and we have West Care. Fresno First, I believe, takes Medi-Cal. But anyhow, there's not really a medical detox for people that have Medi-Cal. And, if you're an opiate addict, you could die tomorrow. We need to get those people some help. So I think right now their best option is to go to a hospital to get meds for a couple days,
sit in the hallway, and
then go to CAP or go to West Care for treatment. It's not good enough.
Would you have a stigma or a systemic change if you had your magic wand that you would
I mean, I would like to tap them both with the magic wand. I've been working on, trying to address mental health and substance use stigma for, past 15, 18 years. And I think, we've evolved, and I think there's still a lot of work to do. And I think that is a critical part. And we've seen that from, community needs assessments. It's evolving. But I think there's system changes that need to happen, whether that's reimbursement rates for substance use, make it more, valuable. Is it really enforcing or enhancing the parity laws towards just like, no, the parity law says if you have insurance, it should be the same for you to access treatment for, and I'll just say like, diabetes as it is for substance use or mental health, for that regard. I think they're both valuable, but I think the systems change. Some of the things, the systemic things would be more important because I think those are, on the local level, we can continue to work on stigma and engage and educate people. It's not easy work, but I think it's fun work. Doing that. I think the systems work is a little harder because it's not always something that's within our control. whether it's funding, whether it's regulations, whether it's law, whether it's policies, things like that. And so that's where I would like to see maybe more of the evolution so that it does make it easier for people to navigate to access. It's not complicated. Things that are really life-saving, whether substance use and mental health, unfortunately, are complicated, and it's life-saving. That should be easy. We should save lives. Make it easy. Make something else harder. We're not asking for like a tax break or something. That's tax code is complicated. Got it. This is trying to save someone's life. That should be very clear cut, easy. Call here, go here, walk in through any door. You'll get seen, and we'll figure it out on the back. And so I think there's attempts, I think statewide to try to do that. We're seeing more and more efforts for integration, like Nolen said that they do in their programs in terms of addressing both the mental health and substance use and the whole person, the overall wellness. There's more move of that. So I'm hopeful for that. Hopeful that we're going to continue to address things with housing insecurity, as well as people who have mental health needs, that everything that's been done, and there's a lot that's been done in Fresno, in the past 5-8 years, is great. And there's still more that has to be done. There's still a lot more. So, if I had to take the two, I'd like, give me the systemic stuff. That's a little harder.
Well, I think, for me, as we begin to wrap up, I think this issue does not discriminate. And I think in my family, I've had family go through addiction programs. And I think as I raise kids, these are things, it's like, these are conversations I know we need to have early and often. And I think both on mental health and substance abuse, it does not discriminate. So I just appreciate the work you're doing. We've been partners with Fresno County Mental Health and Social Services and like all the county educational departments, because we have to tell new stories. So even some of our former staff have been in documentaries that you all have done to just raise and reduce the stigma, raise awareness. And then for the life-changing, like one-on-one work you all do is really, really important. And so anything that you'd want to plug, let us know about, or ways that we can kind of follow the work that you're doing.
I would just give, like, if I could, a real plug. Like, so if people have questions that are in terms of accessing care, we were talking about, they can call the county's 24/7 access line, which is 1-800-654-3937. They can go to hopefresnocounty.com, and that's taken directly to the county's webpage for just information. And then to kind of like some of the stuff Nolen talked about, if you go to recoverfresno.com, that has information on treatment, and as far as ones that are Medi-Cal covered. So that could be a place when they have Medi-Cal, say, hey, go here, because it's got the directory. It's updated every other month. So they can look at that. So that's another one. But I think, destigmatize it. I mean, just from the way we talk about things on a day-to-day basis, like the terms we use and things like that can help change, that guy's just an addict. Like that's a judgment. That's like saying versus, that's a person who's in recovery. That's a person who's experiencing addiction. It's like when I see someone that's maybe less fortunate than I, and my kids say, what are they doing? I'm going like, oh, that guy's just an addict. Say, you know what? Those are people that are having some struggles right now. And some of it may have been, some things didn't go their way, and some of it they're having some struggle, but hopefully someone will be able to help them. So and I guess,
I was walking downtown on Fulton the other day, and it's like, I think even in my mind, right, to grab the thought and be like, that's somebody's sister, like that's somebody's mom, or that's somebody's brother, right? Like just like somebody dearly loves this human. They're not like trash or a show to watch, right?
Yeah, and it's kind of that trauma-informed thing you talked about at the beginning, Andrew. It's not what's wrong with this person. We need to get out of that mindset, and it's more of what has happened to this person.
Yes.
Something along that line has happened that they're here. And so the more of us like Nolen and the folks at EMP that we take that approach and try to really help our community, I think we'll do that. But I didn't want to eat up the time. So.
No. I think I would just encourage everybody to reach out for help if they need it. And, feel free to call us at Touchstone. You can go to the website, touchstonerecoverycenter.com. It's got our admissions line, and we'd be happy to help. Whether or not you end up coming to Touchstone or to another program in the Valley, we take pride in the fact that we'll connect you.
So sweet. Thank you both so much for your time and for talking about this topic that I think for a lot of our listeners probably touches them personally too, not just me and Andrew. So we're really, really grateful. And thank you guys for being on.
Thank you.
For sure. Thank you.
Thanks for tuning in. If you want to find out more about EMP, you can visit us at everyneighborhood.org or follow us at EMP Fresno. Every Neighborhood Partnership and this podcast exists to activate, equip, mobilize, and transform here in Fresno and beyond. If you liked what you've heard, please share and review what's good in the neighborhood wherever you listen. We'll see you next time.